Welcome to the Clinical Cookout.
Hey y'all, it's Auntie Ashley at the Clinical Cookout, and I am here to wrap up our theme this week, which was racial bias in medical and mental health care. Now, y'all, this is one area that I am very passionate about this particular area. And you wanna know why? Because to me, racial bias in this particular area is a matter of life and death. Racial bias has caused the death of people who look like me. And that's a problem for me. So I'm always going to be passionate about it. I'm always going to go hard for it because it's super important. Now, that being said, I hope y'all watched our episode this past Wednesday. We had a very special guest, Dr. Emery Butler, a board-certified OBGYN, and she gave us perspective from the medical side specifically, and of course the aunties gave the perspective of the mental health side. Now, that being said, I only got 3 things to talk to y'all about today to wrap us up. 1, it is very harmful for those who say, oh, it's not happening like that anymore, or y'all over exaggerating, it ain't like that now, or it depends on who you are. No, I don't care who you are, what your career or job, your social status, your economic status. Racial bias can and likely will happen to you. If you are one of the rare few people who has never experienced racial bias in this area, that is actually a blessing, and that is not the norm. Let's just be clear. It is more normal to experience it than not. And again, when it comes to racial bias in these areas, it becomes a matter of life or death, or just your general well-being health-wise, which is why it's so important. Now, that said, point 2, on the professional side, I know that on the episode we talked about cultural competency and the teaching of cultural competency in our programs, whether it be our graduate programs, doctorate programs, whatever. But here's my thing. It's not enough. Again, keep in mind, racial bias can literally be a matter of life or death. It is not enough to say, oh, there was a cultural competency course, or there was a certification that I did. That's not enough to me. And it shouldn't have to be that I have to go further along to learn more. Like, I shouldn't have to go to a doctorate program to get deeper into it. And I doggone sure should not have to research it myself. That makes no sense. I got to do extra research outside of the curriculum to learn what I need to learn in order to be able to care for people who look like me, or on the flip side, for our white professionals to be able to care for people who don't look like them. That's not okay. And then you'll have many professionals, both people of color, black professionals, and white professionals, who say, well, they've added it into the curriculum. They're trying. Do y'all realize that this has been a problem for over 2,500 years, according to the National Institute of Health? And to say they are trying, they are doing better, that's not enough for me. I don't give kudos for crumbs. So no, that ain't gonna get it. Because again, it's a matter of life and death. In fact, let me just briefly read y'all something from a peer-reviewed scholarly article from the Journal of the National Medical Association, which is this actual article is located in the National Library of Medicine on the National Institute of Health's website. Racism in medicine, a problem with roots over 2,500 years old, is a historical continuum that continuously affects African Americans' health and the way they receive health care. Racism is, in part, responsible for the fact African Americans, since being kidnapped and brought here as slaves, I paraphrase that because they said arrived here, we didn't arrive. We were forcibly brought here, have had the worst health care, the worst health status, and the worst health outcomes of any racial or ethnic group in the U.S. Many famous doctors, philosophers, and scientists of each historical era were involved in creating and perpetuating racial inferiority mythology and stereotypes. Such theories were routinely taught in U.S. medical schools in the 18th, 19th, and first half of the 20th centuries. Sidebar, is still taught. Let's not pretend like it's not, but this is an older article. The conceptualization of race moved from the biological to the sociological sphere with the march of science. The atmosphere created by racial inferiority theories and stereotypes, 246 years of black chattel slavery, along with biased educational processes, almost inevitably led to medical and scientific abuse, unethical experimentation, and overutilization of African Americans as subjects for teaching and training purposes. I don't understand how we can say, some of us can say, it's not that big of a deal, it doesn't still happen, when it's readily admitted by the larger entities and organizations. So again, what they're doing now is still not enough after 2,500 years. Third and last thing, For the clients, patients out there, anyone who has to see a doctor or sees a therapist or would like to see a therapist, whatever, which that means all of us. Understand, you have to advocate for yourself as well. And if you struggle to do that or you don't know how to do that, at every hospital, there is something called a patient advocate. You have the legal right to request the patient advocate at any time. So request that person so that they are there to explain things to you if you don't understand what that doctor is saying or that nurse. And just so you can feel comfortable knowing that someone is on your side. The patient advocate is someone on your side. And it's even better if you got a family member or a friend that you trust that can go with you and sit with you and understand what is happening or what you're being told at a doctor's visit. As far as therapy, that you interview, like Auntie Shug said earlier this week, you get to interview that therapist just like they are interviewing you to make sure that you are a fit for them and they are able to work with you on what you need. Now, it is nothing wrong with seeing a therapist that is a non-POC, non-person of color. But if you feel you're most comfortable seeing a reflection of yourself, that is perfectly okay. You can find us out here. It might not be a whole lot of us yet, but we're out here. That's all I got for y'all. I hope y'all enjoyed this week's content. And guess what? Next week, the aunties will be live on Wednesday. So it is a live session with the aunties on Wednesday at 8 Eastern Standard Time on YouTube, Facebook, and IG. And don't forget, go to our website, www.theclinicalcookout.org, to register for the in-person Clinical Cookout event this July in Cleveland, Ohio on July 13th, and to order your Clinical Cookout Conversation card deck. They are in pre-order still, but that will be done on the 15th. All right, y'all, have a beautiful, wonderful rest of the weekend, and the aunties will see you next week.